Hello everybody, Brennan here in the Well Chiropractic Rehab Room. Today I'm going to be going over some exercises with Amanda, and these are exercises that we're going to ask you as a patient do here at the clinic. And so there's a numerous amount of exercises that we have, and today we're going to be working on some core exercises. And why those are important is because we need to strengthen our core to help take the pressure off our low back. A lot of people use their back muscles way too much, and we need to help strengthen that core so your core will naturally squeeze in moments like when you're doing the dishes or bending or twisting or whatever activity you're doing. And so we're going to do what's called beginning core on ball. This is what the basic core exercises that we do with patients here. And so I'm going to be doing with Amanda and demonstrating, and have her do them with me. And so Amanda, what we're going to do first is we're going to do some pelvic tilts on the ball. And what we're going to do is we're going to squeeze our core. We're going to activate it. I don't want you squeezing so tight that you can't breathe, but just squeezing the core. Does it feel hard? Go and feel that stomach. Does it feel like you're squeezing tight? Okay, now while you're doing that, we want to be sitting up straight. Okay, because if we're retraining our brain to do something, we want to retrain our brain to have good posture rather than here squeezing the core. So while sitting up straight, what we're going to do is we're going to rock our pelvis forward, and then we're going to stick our butt out. And I'm going to do it kind of from the side here so you guys can see. So squeezing that core, we're rocking that pelvis forward, and then we're sticking the butt out. And this helps create motion in the pelvis. And this helps the body find neutral pelvis. People that are either stick their butt out too far or they tuck their pelvis too far in. So doing these can help retrain the brain to have the pelvis sit in the correct position. Does that feel okay? Awesome. So as you can see, we're not slouching too much. We're keeping our upper body straight, just moving that pelvis. And we instruct people to do about 100 of these a day, about 10 an hour, which may seem a lot, but if you do 10 an hour, it's actually pretty smooth. Now what we're gonna have Amanda do is some side to side lumbar rock. So what we're gonna do is squeezing the core, Amanda, so we're sitting straight up. And we're going to thrust that hip on the left side all the way up and then on the right. And what you're going to feel is a little stretch in the obliques here. And again, this is creating motion in the pelvis. We like to say at Well Chiropractic that motion is motion. We don't want to become stiff. And the next one we're going to do is rotation on the ball. So we're going to squeeze that core again, and we're sitting straight up. We're going to rotate our pelvis. Now what we're not looking for is rotating around the ball like this. That isn't what we're looking for. We're just going to make circles with our pelvis on the ball. So you can see a difference when we do this compared to this. We're keeping that upper body straight. And it's very normal to feel pressure in the low back when you're doing this. It's very normal to feel pressure in the core when you're doing this. This is a new exercise. Any new exercise is going to cause maybe just a little bit of pain or a little bit of discomfort. That's nothing to worry about. As long as you're not feeling any sharp shooting pain, we actually urge you to continue to do these exercises to help work things out in the low back. So doing those rotations, now we're going to go the other way. We're going to even it out, just like running on a track, while squeezing that core. We find that when patients do this, that they end up feeling actually pretty good afterwards. But it can increase inflammation, and so we do ask, hey, maybe put a little bit of ice on afterwards, or do a little bit of stretch to help reduce that inflammation after seeing the chiropractor. Okay, now what we're going to do is marching. So squeezing that core, Amanda, what we're going to do is one leg at a time, lifting. Now, if it's too hard for you to balance, you can put your hands on the ball or on your knees if that makes you feel comfortable. I usually have people put their hands on their stomach, and that helps show them that their core is tight. We don't want to be leaning too far back or too far forward or have our legs too far out. We usually like to keep the knees in line with the hips.